Hey guys, just wanted to do a quick update. I'm sorry it's taken me so long. I know 3 weeks is not acceptable to not post, but I was in the hospital 4 times since that last video and just haven't had any real news. It's been probably the most difficult pregnancy I've had so far and the most confusing, to say the least. Basically, last I talked to you guys, I had gone to the ER for OHSS and they did an ultrasound to measure the fluid and did all that, and didn't see a baby, which at 4 weeks and 5 days, we should have seen even just the tiniest sac. We should have seen something, and there was nothing. It was just a uterus. Like, there was nothing in there. And then I went back at 5 weeks, so 5 days later, did another ultrasound, blood work, everything. Nothing in my uterus. At 5 weeks, you should definitely see something in your uterus. So we both just kind of settled in our hearts that it wasn't going to be a positive pregnancy, and we were both really down and kind of anxious about it. My HCG did continue to double until it got over 2,000, and then it started to double every 56 hours, which is still considered appropriate. Especially, they say over 1,200, it starts to slow down a little bit. So, yeah, my last HCG at 5 weeks, 5 days was at 10,000. So everything looks good HCG wise. And then at 5 weeks, 5 days, I had my last doctor's appointment to check on the fluid levels in my ovary again. And we did an ultrasound. And here's where I'm super confused, is there was nothing on there at 4 weeks, 5 days, nothing at 5 weeks, and 5 days later, she puts the wand in and she sees, it's so hard to explain this ultrasound. Immediately, I see like 3 or 4 sacs immediately. And none of it looked normal though. There was one sac in the middle that looked pretty normal, and I saw a yolk sac, and she measured the gestational sac. It was 12 millimeters. The yolk sac was at like 3.2 or 3.4 millimeters. Sorry, airplanes. So what's weird is that if it was at 12 millimeters at 5 weeks, 5 days, we should have for sure seen it at the 5 week mark, because after 4 weeks, you should have your sac growing at about 1 millimeter a day. So we should have seen at least like a 7 millimeter sac or something around there. But there was nothing. So I'm not sure if I had so much excess fluid that it was like pressing on my uterus and you just couldn't see. So yeah, there was, it looked weird because there was a bunch of like debris in my uterus when just days before there was nothing, and I haven't had any bleeding, nothing like that. And so she measured that one sac, didn't really say anything about the others. I definitely saw a second sac, if not a third. And then right before she was done with the whole ultrasound, I said, is there any way I can get a picture since my husband can't be here? And she's like, it's just gonna be the gestational sac, which, by the way, this was done at a military hospital with like a young girl who, yeah, they can't even say anything. So she just quickly scanned back to my uterus, hit print, and this is what I got. So keep in mind that days before there was nothing on this scan. This sac right here was the one that looked normal and had a yolk sac, but you can't see it in this picture. There was definitely a second sac down here in a different view, and then it looks like there was a third sac above as well. And then there's all this, like, it almost looks like there's a bleed in my uterus, but I haven't bled at all, like nothing, not even a little bit of spotting. So yeah, I am 7 weeks pregnant tomorrow. We have our first official ultrasound, and I go back and forth on whether I think there's going to be one healthy baby, a baby at all. I have no idea what to feel. I'm just so ready to know. It's one of those things where the last couple weeks have been so hard with OHSS, and then just how I've been feeling, and then the anxiety over not seeing a sac and then seeing this, that even if it's not a positive outcome, I'm just ready for like knowing the outcome, just what is going to happen. I do have a lot of symptoms. My sense of smell that was there for my 2 previous pregnancies is here in full force. I can smell somebody's breath from like 6 feet away. I can smell things that I shouldn't be able to smell. Like I'll be sitting near a closet and I'm like, I can smell that one candle that's called blah, 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 blah. And sure enough, it'll be like in the closet. Like I can smell really bizarre like things. I have been exhausted, just sleeping a lot, napping a lot. And then nausea has hit full force. I feel a little gross when I wake up, but the biggest like time of day that I'm nauseous is around 1 p.m. to 3 p.m. It is really bad. And so usually I just try and nap during that time so that I feel less sick, so that I'm like sleeping during that phase. But yeah, it's not good. But I'm grateful for symptoms. I'm grateful. I don't want to sound ungrateful for this pregnancy or for anything we've gone through. It's just been, it's compared to my last 2 pregnancies, I've had more medical issues with the OHSS, and then more ultrasounds early on, and more HCG draws. So there's been more to analyze and be anxious about. And it just hasn't made it a pleasant experience so far. And it makes me sad that this has still been Jeremy's experience with going through pregnancy and stuff, that it's kind of been a rough road so far. So I will keep you guys posted on what we find out tomorrow. I'm hoping for one healthy baby with a heartbeat. I could just use some peace and some relief. So yeah, thank you guys for being patient. I know I should have updated way sooner, but I just didn't feel good and didn't really know what to say. I didn't know how to explain that it looked like a bomb went off in my uterus, because that's honestly what it looks like. It's just really bizarre. And the ultrasound techs can't say anything at the military base about what they see. And all they did was call me later and be like, yeah, it looks like your OHSS got better. Because the point of this appointment wasn't to look at the baby. So they don't say anything about all of this craziness. So tomorrow's the day. 24 hours from now, we will know if there's a healthy baby or not. So stay tuned.